Hi nurses, this video is just for you. In this video, I'm going to explain how to approach a writing task, how to use your 5 minutes reading time effectively, how to demonstrate the 6 assessment criteria in your writing, how to use the sample answer provided, and how to learn from completed writing tasks. So let's get started. The nursing writing test includes 3 possible types of letter: referral, discharge, and transfer. The reader of your letter could be to a number of different healthcare professions. For example, nurse to nurse, nurse to doctor, nurse to an allied health professional, such as a physiotherapist, dietitian, etc. Until you turn over the test booklet at the start of the reading time, you don't know which scenario it's going to be. The most important point is to be prepared to be flexible, to meet any one of these letters and readers. Every patient is different. Their social background, their medical history, their current situation, these will all be different. Just like you wouldn't speak to each patient you meet during your working day using the same language and expressions, you need to be ready to use language and paragraph structure to make your letter personalised to this patient and this situation. Only then will you be demonstrating to the assessors that you have the English required to score a C+ grade or higher. Turning over the test booklet, there are 3 things you want to check as a priority. Although you cannot highlight or make any marks on your test booklet in the reading time, I'm going to highlight these 3 things so you can clearly see what my eyes are looking at and can follow the approach yourself. The first 2 pieces of information are provided at the end of the case notes, so go straight there first. Who are you writing to and what is their job role? We can see that we're writing a letter to Mrs. Cullen, a university practice nurse. What are you writing to her about? We can see that in the letter we're going to briefly outline the patient, Jake Peterson's history, and your concerns. Back at the start of the case notes, you will find the 3rd piece of information. What is your role in the patient's care? We can see that you are writing as a nurse at a boarding school, and that Jake Peterson is a male student at your school who has come to you complaining of hair loss and associated depression. At this point, you might be worried that you haven't written a letter to a university nurse before, but don't panic. Although the setting may be different to a task you have seen or practiced before, at a basic level, it is still a letter from one nurse to another nurse, and you will be able to apply your knowledge of this letter type to this scenario. So far, these 3 pieces of information haven't told me specifically what type of letter I'm writing. This is useful to know when thinking about the purpose of my letter, one of the assessment criteria. Looking again at those 2 areas of the case notes doesn't answer my question, so I look above to the most recent information about the patient and find these details at the end of the case notes. I can see I'm writing a letter to a university medical practice to monitor and organise special exam arrangements. From these details, I can understand I'm transferring Jake from my care at the school to the nurse at the university. With this in mind, and remembering the specific reasons for writing this letter, to monitor Jake's condition and organise special exam arrangements, I can start reading through the case notes line by line, deciding whether each one is relevant to the reader or not. To help me make the decision, I will ask myself 2 questions each time. Is this case note relevant to the current situation? And will this case note affect how the reader continues care for the patient? If the answer to both questions is no, I can omit this information. But if the answer to either question is yes, I will include this information somewhere in the letter. In the reading time, you have to make mental notes as you read for your understanding, but I'm going to highlight the notes which I pick out to be relevant so you can see what I'm doing. Jake's name and date of birth are going to be useful to include in the RE line, but his age is not particularly important given that he's about to go to university. and the address of the school is also not something I need to include. From Jake's social background, I can see that there are a lot of details here that I don't need to include in my letter. I notice that his father has male pattern baldness, but as it onset in his 50s, it's unlikely to be linked to Jake's current hair loss. Moving on to the presenting complaint, all of this information is going to be important for me to include to the reader as the reason for writing. I can also see that the depression has not been clinically confirmed from the use of the question mark at the beginning of the line. At the start of the treatment summary, I noticed the dates start in 2014. So I skimmed down this column to get a sense of the timeline, which is going to be important for me to clearly communicate Jake's history to the reader. The first appointments were in March 2014 and May 2014. And then between 2014 to 2018, there were no further appointments until December 2018. Then we have regular appointments occurring in February, March, May, June, July, and today in August in 2019. This helps me consider my structure. I can start to imagine one paragraph explaining the initial history in 2014, and then another paragraph on the more recent history. Looking at each date in detail, and starting in March, I noticed that Jake presented with hair loss in patches and anxiety, and that the nurse makes a guess about what could be the cause of this as a possible school bullying incident. Also that she refers him to a trichology specialist. In May 2014, we can see the trichologist's report that no etiology was established and the condition is possibly exacerbated by stress. I noticed that a steroid cream was prescribed, but that it caused personality changes, aggression and sleep loss, and so the medication was discontinued. Between 2014 and 2018, there was no further hair loss and intermittent hair regrowth. Thinking about those two visits together, I can now make some decisions about which details are relevant. From the first visit, the presentation details are relevant. From the second visit, the detail that no cause could be established is relevant, and it would also be important to mention that medication was prescribed but discontinued. The specifics of the medication are not relevant, but the reasons for discontinuing it are. Then there are 4 years where the symptoms seem to be resolved. In December 2018, the anxiety returns and with it pronounced hair loss. At Jake's checkup, we notice that he has lost 6 kilograms over the last 2 months. I can see that the nurse recommended that Jake sees a doctor about his hair loss, anxiety and weight loss, but that Jake is reluctant. He asks about natural remedies, for example homeopathy, and that the nurse discusses the efficacy of these, but that Jake is still keen to try. When he returns in February, I can see that there have been no results and that also the cost implications of the homeopathic treatment have led to an increase in Jake's distress and low mood. The next 2 points look interesting, but are not relevant to the reasons that I'm writing to the reader about. In March 2019, Jake was referred to the school counsellor but did not attend. And in May 2019, at the checkup, we see that he has increased alcohol consumption to at least 28 units per week. June and July is described as exam time, which causes Jake extreme anxiety and he needs to have a separate exam room. It's also mentioned that there is increased hair loss at this time. The final point from today's visit is that Jake is concerned about his transition to university and independent living. Having reached the end of the case notes and talking myself through the situation, I now feel I have a good understanding of Jake's history, but also how I'm going to structure my letter. If I still have time left out of the 5 minutes reading time, I would read through everything again carefully, reminding myself of the decisions I just made. Once the writing time starts, I would now underline those notes which I highlighted for you, so I have a clear record of the information I want to include in my letter. I would also turn to the blank page on the back of the answer booklet and make a very rough plan of my letter structure. In the introduction, I will explain Jake's transfer and his health conditions, the alopecia and possible depression. In the middle paragraphs, I will focus on how the situation has developed in the last 5 years. In the final paragraph, I will include the specific requests for the reader, the monitoring and special exam arrangements. I'm now ready to start writing. I have a clear plan in my mind, and it should be easy to record all the information in the 35 minutes I will have left and still keep some of this time to check my work at the end. I'm not going to write the whole letter now, but just to point out a few things. Opening my answer booklet, I'm going to start with the reader's name and the address, which I can copy directly from the writing task. Underneath this, I will add the date, which is today in the case notes, so 30th of August 2019. Next comes my greeting, Dear Mrs. Cullen, followed by the RE line, Mr. Jake Peterson, DOB 1703-2001. But remember, the order of the greeting and the RE line can be reversed if you prefer. Then will come the body of my letter, the paragraphs. The introduction, introducing the reason for writing, then the history paragraph, the current situation paragraph, and finally the request paragraph. Underneath all of this, I will add my ending, yours sincerely, and finally my job title, nurse. As you write the paragraphs, think about how you will summarise the information. The aim is not to write one case note per sentence. For example, the information about the initial history could be combined into 1 or 2 sentences. Once you have finished writing, use any time you have left to check your letter against the case notes you underlined to make sure you have included everything you identified was relevant. Read it as the university nurse. By the end of the letter, do you understand Jake's situation and what you need to do for him? If necessary, make edits to your letter if anything needs clarifying or adding. Now you have your completed letter, it's time to look at the sample answer. There are some important things to remember with sample letters for official OET tasks. They have been written and checked by both language experts and a nurse subject matter expert to make sure they are accurate medically and linguistically. That doesn't mean that they are perfect or seen as the only way to write a letter about these case notes. You might have used slightly different language or structure to your letter. Provided you have communicated the situation as per the task clearly to the reader, this will not be a problem. When reading the sample answer afterwards, notice the similarities and differences. If there are any differences, rather than seeing it as something that has to be corrected in your letter, think about why it is different. Why do you think the writer used this word or phrase? Is it more formal? Does it allow them to summarize some detail more effectively? Why do you think they structured their letter like this? Is there any difference in clarity between your version and their version? I want to finish off by giving you a few tips about how you can get the most out of this set of case notes after you've written the letter. Don't just discard this task and letter and move straight on to another task. Take time after each practice letter to learn from it and avoid making the same mistakes next time. Here are 5 things you can do to get the most value out of each practice task you complete. Assess your writing and the sample answer against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the 6 criteria you are assessed on, as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn, read the evidence statement for each level, and critically decide which statement is the best match for your writing. Type your letter into a document and check your language and grammar by using free tools such as Grammarly or the spell checker and grammar functions built into your word processing software. Notice the mistakes that are picked up and use them to create your own checklist of common errors to learn from. rewrite your letter so you have a perfect copy to refer to as you revise. If you keep looking at your original letter with the mistakes in it, you are training your brain to remember the mistakes. Having a perfect copy to revise from will help improve the accuracy of your writing. Use the case notes as the basis for a speaking role play. Imagine you are having a conversation with Jake in December 2018 when he was interested in trying homeopathic treatment. Ask a friend or colleague to play Jake's role while you provide advice about his suggestion and try to persuade him to visit a doctor instead. Search the internet for podcasts on alopecia or medical journal articles covering recent developments in the treatment of the condition to practice your skills for the reading and listening parts of the test. Remember, with the right approach, the writing test is something everyone can do well. For more videos and test strategies, follow our social media channels on Facebook, YouTube and Instagram @official OET, and search the OET blog available on our website.